So we'll go ahead and get started. I will say, and then I'm gonna grab a seat here in a second, you're in for a real treat. One thing I can tell you is obviously, we have some great elected officials in this community, and we're joined here by 4 of them today, and really want to have a conversation about what their priorities might be, as well as the opportunity to talk a little bit about the intersection in healthcare. So with no further ado, I'll grab a seat and we'll get started. Okay, so I'm gonna run down, and what we're gonna do is I'll introduce each speaker, and as we introduce them, they're each gonna take about 5 minutes to share some thoughts, and then we'll get into some Q&A. And at the very end, if we have time, we might take some audience questions. But for those audience questions, I will point you to our mobile app. You have the ability to submit those questions, so those will get queued up if there are any questions at the very end. So, starting first to my left, we're joined by Mayor Rebecca Jones. Rebecca is the mayor for the city of San Marcos. She has served starting back in 2007 through 2018 on city council and has been mayor since 2018. So, Mayor, if I can turn to you first and offer up any thoughts you may have.
Yes, thank you so much. Well, it's been such an honor and a pleasure to serve the city of San Marcos. We're right around 100,000 people. We have worked very, very hard to change the city in many ways, and making it a better place, of course. The quality of life is very good. We're about 25 square miles. We have a lot of higher education in our city with about 40,000 students coming in every single day. So we have a lot of unique challenges, but a lot of things that are really going well for our city. And we're kind of known as the healthcare, we're becoming the healthcare hub of North County, but we're currently the educational hub of North County. And it's just been such a great honor and all of the things that we've been able to do in the city. And I'll get to those a little bit later, but thank you very much for the introduction.
Thank you. And obviously, Kaiser's recently opened up a hospital, so obviously there is a lot of growth in the city of San Marcos. Next up, we have Supervisor Luis Plancarte. So we're changing gears. We're moving out now to Imperial County. And obviously, the supervisor out there, we have 2 hospitals. So, there's a lot going on in healthcare in that region currently. Obviously, more to come. He has served as supervisor since 2017. So, Supervisor, if I can turn it to you for some opening remarks.
Thank you very much. Good afternoon, everybody, and thank you very much for inviting us to be here. And thank you for the great accommodations. What I'm trying to figure out is how do we follow our last presenter? So we will try to find something to do. A little bit about Imperial County. Imperial County is about 4,200 square miles. The difference between San Diego County and Imperial County is probably 25 to 30 square miles. We're about the same size. But Imperial County has about 180,000 residents during the night. During the day, we have about 50,000 people who legally work in the U.S. and can legally live in the U.S., but they, for different reasons, choose to live in Mexico. Whether it's ongoing family, spouse that may not cross the border, cost of living. And I'm sure that Supervisor Chairwoman Vargas and I will share probably some issues on them because we both represent border communities. But during the day, we increase by about another 50,000 people. Those are people that shop, pay taxes. Most of them are very, to a certain level, involved in the community. But they also seek health care on the other side of the border quite often. So that's very interesting that, we might look at that. We are primarily Hispanic, Latino, and I tell people we're Mexican. I'm not into politically correct. Most of us in our area are Mexican. About 80% of us speak Spanish. It's our primary language go-to. And I'm going to guess that maybe 25% or so is English only. But you would be amazed the amount of Spanish in our communities. Education, 71% are high school graduates, 30% are not. And our unemployment rate has a tendency to hover about 20% when the national average is 5%. So how do we deal with a community that has a high unemployment rate We will talk about some of the health conditions that are evident in our community. But think about it, 1 out of every 5 does not have a job. And so it is for that one of the reasons that I am so grateful that you allow us to present you with this information, because there is opportunity in our community to make a difference. And we'll explore that today. Thank you.
Thank you for those comments. Next up, we have Supervisor Nora Vargas. We're pleased to have the supervisor serve as our board chair for the Board of Supes the last couple of years, and do want to take a moment before we get started to also thank the supervisor. She was instrumental in seeing some delays around SB 43. Not that we don't want individuals who need help to get help, but we need some time to actually allow the infrastructure and planning and training to take place. So Supervisor, thank you for that. She has served on the San Diego County Board of Supervisors since 2021. So if I can turn to you, please.
Thank you, and good afternoon, everyone. Buenas tardes. Nora Vargas, as it was mentioned, Chair of the Board of Supervisors. And I am so excited to be here. I wanted to first and foremost say thank you to all of you. I haven't had a chance to do that publicly, and to say thank you for helping us. First, in the first 2 years during COVID, I see some of my heroes in the room today and sheroes, people who really went out of their way to make sure that you helped our communities, particularly the communities of South Bay. I see Nick, I see folks who helped me think outside the box so that we could really make sure that our communities were saved, and particularly the communities of color, BIPOC communities in the county of San Diego and in District 1. I have the honor and the pleasure, I just got reelected, highest vote getter, in case anybody wanted to know, for the county of San Diego. And if you don't know my background, I was an executive with Planned Parenthood for about 20 plus years. And so I come from the world of healthcare, and removing access to barrier has been my mission in life, whether it's in education, healthcare, and these are the issues that I care about, and what I wake up every day thinking about how I can help someone and make people's lives better. And I am one of the things that I'm really excited about is I actually got to open the first Planned Parenthood in Imperial County, but that's a whole other conversation for another time. What I wanted to say today, and I'm hoping that we're going to have this conversation as we continue to have this dialogue, is that the County of San Diego's $8.5 billion budget, I think about $1.3 billion of that budget is from the federal government. Why does that matter? Is because things have changed, as you all know, at the national level. That's going to have a huge impact on us, not just because of the threats of deportation and what does that look like in terms of healthcare, how does that impact our local communities, our hospitals, but also because of the programs that are going to be impacted. If the Department of Education gets removed, our kids get access to food in schools in the morning for breakfast and for lunch. So I think there's a lot to think about and to talk about today. And how are we, as all of you, as the first, you are with us, the safety net providers for our communities. How are we going to work together in coalition to make sure that our communities are safe and healthy during many of the changes that are going to be happening? And so excited about the work, and also excited to have this conversation today. Thank you.
Thank you. And last but definitely not least, I will say, is Councilmember Marni von Wilpert. Marni has been on San Diego City Council since 2020. She serves District 5. Full transparency, she's my council member, as I'm a resident of District 5. So if I can turn to you for some remarks, please.
Thank you. Thank you all very much for having us today. I'm so honored to be on a panel discussing healthcare as a local government official. My very first experience with access to public health was when I was deep in the bush in sub-Saharan Africa. And I lived in a village with no running water or electricity. And I was a social worker in United States Peace Corps. And my job was to take care of children born HIV positive whose parents had died in the AIDS epidemic in Africa. And I had a big responsibility on my hands to get a lot of young kids with very serious medical conditions access to healthcare. And every month we would get them food and clothing and even medication, because Bill and Melinda Gates Foundation and President Bush II in the Mayo Clinic did a big effort to get antiretrovirals to young people. But I couldn't protect them from the stigma and the discrimination that would follow them their whole lives because they were born with HIV. And I'd see them expelled from school at 12 years old. That's it. Forbidden from high school, forbidden from college because they got the purple blotches, the Kaposi sarcoma on their skin. And that's when I realized public health isn't just about medicine. It's also about society and the rules we make and how we treat each other. So that motivated me to go to law school. But to go to law school, since we had no electricity in my village, I would hitchhike for 2 hours on the one paved road we had into town. I'd find an internet cafe and I'd type out my law school application essays and email them to my mother here in San Diego. She would print them out and mail them to law schools around the country. And that's how I found out I got into law school in New York City. And I've been a lawyer ever since. And then a screw must have come loose in my mind, so I ran for office and just got reelected. I'm very proud to be representing my hometown of San Diego. And one of the things I realized very quickly, because Chair Vargas and I were elected at the same time in 2020 in the middle of the COVID-19 pandemic. We were sworn in by ourselves on Zoom. Mm-hmm. And I realized very quickly that our local governments had to work together to keep people alive. So we've reached out to the medical communities and the hospitals, and there are many people in this room who have worked with me personally to work on city issues that I'm very proud of. The first was a law banning the sale of flavored tobacco products, Juul, and all the vaping that's attacking our children in schools. Scripps Healthcare was incredibly important. Amber helped a lot with that. So did Kaiser Permanente. They came in hard to educate my colleagues on why we had to ban flavored nicotine. Our ambulance and EMS system. You know, your hospital patients are our residents. And often their trip to the emergency room starts with my EMS employees, my firefighters, our ambulance companies, our police officers, picking them up and taking them to your hospitals. I know that AB 40 has had quite the effect. I'd love to hear more about that and what's going on with wall times, but it's been hard because your reimbursement rates have been flat for decades. So one of the things I'm trying to work on is diverting unnecessary 911 calls to hospitals. Now that we have taken over our ambulance deployment system, we have the alliance model in the city of San Diego. We could do what other cities do, including Dallas, which is having nurses triage 911 emergencies and see, do they really need to be at an emergency room? Often people call who do not need an ALS service. Same thing with workforce shortages. We're trying very hard to work with our workforce partnership to make sure that we have trained nurses and physician's assistants and others who can actually fill the roles that we depend on when we call 911 and end up in a hospital. And our behavioral health system is something that I'm very glad that you are all taking on. Thank you for your work on that. I mean, you've been great leaders, Chair, in steering the direction on this. But when I was a deputy city attorney, I got to sue the opioid companies. We sued the Sackler family, we sued Walgreens, McKesson, CVS, everyone who participated in engendering this epidemic of addiction. And when we got settlement money at the city, I realized the city can't help with this. We need the help of hospitals. So I reached out to UCSD, and Patty Mesa and Nick Mascione is here, and Steve Coe all called us back. And I gave city money, city opioid settlement money to UCSD to use it to hire on-call psychologists and peer educators who can be in the emergency room for when someone overdoses and wakes up and survives that overdose. That is the window to get to them. Not when they're back on the street and we're having to deal with them as a homeless individual, not when they're back at home and their family doesn't know how to care for them, right there. So we've given them that money as a pilot program to say, let's help stop this revolving door back to the street, back to home, into the ER of opioid addiction. And that's another way we in local government are partnering with all of you. So I'm very, very happy to be here. I'd love to listen and hear more ideas and thoughts of what we can do, but thanks for having me.
And so I'd be remiss, you did trigger something. Thank you for your leadership, because I know at a city level, EMS was a challenge. Yes. And I know you were working hard in your public safety committee. And I know we lended our voice to some of those conversations, but really do appreciate your leadership there. I know those aren't easy conversations. So you've heard a lot of ground covered. You know, obviously some of the priorities you've heard mixed in there around behavioral health, around EMS, around just our hospitals and the role that we play in communities. So I'm going to start with our first question. And we'll start back at this end. Mayor, we'll start with you. Community health is often shaped by factors beyond healthcare access, including education, environment, housing, and employment. What are your top community health priorities for 2025?
Well, thank you for that question. So healthcare is a lot of different things. It's mental health, it's physical health, it's being out and active, and it's making sure that people are eating properly because my ex-husband was diagnosed in 2006 with stage 4 prostate cancer. So I know a lot about healthy eating and how that can actually help heal your body in many ways that we're not even thinking about. So one of the priorities that I have is to figure out to find someone to help me get a healthy eating program, especially in our low-income areas, which in San Marcos, we've been very intentional of making sure that we are housing people. So yesterday we actually had a grand opening of another affordable housing development. So we're at a city of almost 100,000 with almost 3,400, so it's 3,394 deed restricted affordable housing units, which is substantial. It's 10% of our total housing. That doesn't just happen. It takes a lot of hard work to get to that. It takes the right folks that are, developers. It takes money from the county, and thank you, Chair Vargas, for making sure that we have money available for this housing. In the almost 18 years that I've been on the City Council, I've been a huge champion for that housing. That is a part of it. Again, the educational part of it is also very important. So in San Marcos, I mentioned a little bit earlier that we have about 40,000 students that come into San Marcos. We have CSU San Marcos, we have Palomar College, we have Pima Medical, St. Augustine for Health Sciences, and I didn't catch the name, but I was speaking to a gentleman earlier. He just opened another educational higher learning for our city. So we're actually creating a talent pool in San Marcos. But of course, they need somewhere to live. San Marcos also, we have a 12-story building, the tallest north of UTC, under construction, 460 units that is geared toward faculty at CSU San Marcos, and then also Kaiser Permanente. Oh, and I didn't even get into Kaiser Permanente yet. So last year we opened a 206-bed hospital. So that added to our what I call our creating San Marcos as a healthcare hub of North County. So again, we have a lot going on in the city, but a lot of it takes a lot of good planning. And if you look back, I used to be a new home sales agent in the early 90s. And at that time, Kaiser Permanente and also Scripps Health owned pieces of property where there were going to be 2 hospitals. Kaiser has moved forward during my first term as mayor. Just got elected in 22 for my second term. And then Scripps still owns some properties, so they will likely be moving forward with some sort of medical use on that. So we have a very good array of health choices for our community, from Scripps Health, where they have medical offices, Palomar Health, and then we also have Kaiser Permanente, and then we're also neighborhood health care, and then True Care. So something literally for everyone, which I'm really proud of that. A lot of times people don't really think about your lower income areas and really providing the services that they need. We've been very intentional in that. And in fact, still trying to move forward, like I said, with a healthcare, healthy eating program. And I hope that someone out there really wants to take that on, because it's not something that a city would actually even talk about. But as I mentioned earlier, it really does make a difference in your body healing itself many times with the right nutrition. And I can tell you this, I certainly didn't know what I didn't know at the time when my ex-husband was diagnosed with cancer. And by the way, he's still alive. So this much later, he is doing well. And a lot of it I really do attribute to that healthy eating part of it. So a lot, happening in San Marcos. And by the way, for all of you out there that aren't familiar too much with North County, we are the upside of San Diego. And I don't mean that in a disrespectful way, but we have a lot of really great things in North County. And one thing I did want to also mention is when Kaiser Permanente called me up and said, "Do you still want a hospital here?" I said, "Well, absolutely. There are 180,000 subscribers in North County alone. We need a place for them to go to that isn't Kearney Mesa, that is more convenient for them." As a San Diego native, I grew up in East County, Ramona, and El Cajon, and now we have an option, in North County, which is really important. Ramona's kind of on that cusp. Are you in North County or East County? I still consider it North County. So really having those options for people. And then Kaiser was also just named as a stroke facility as well. So a lot happening, a lot of exciting things, and continued moving forward with those health options in San Marcos.
Thank you for that answer. And obviously, if somebody has a healthy ED program,
I'm ready. I'm ready. Well, let's talk about
can
that.
help you. And the first partner has it too. I don't know if you're aware, right? The first partner of California has been a leader on the issue of equity around healthcare. Around food. And so they actually have programs with farmers here in San Diego County. Our county of San Diego has been a leader. We have a coalition of all of the providers, and I'm happy to make that connection for you. And you can be part of our
love to.
leadership program. Yeah.
awesome. Making things happen on stage.
Exactly.
All the time.
So, Chair Plancarte, if I can go to you, please.
Thank you. So I'll cover it from different angles. Right now, we're in the process of releasing a couple reports that our county health department and other agencies have been working on for a while. One is the county community health assessment, which I'll discuss more in detail. But as a result of that, you cannot do a health assessment without having a strategic plan. And so I believe that probably January, we will see that released. As any publication that has long-term information, it's going through verification and things that must be considered. But among the assessment, there's three things that have been identified that I wanted to cover here today. One of them is high quality to healthcare. And with that, I'd like to visit two sides of it. Right now, our hospitals are enough to stabilize you and ship you out. We either ship you out to Palm Desert, San Diego, and where you can get the care that you need. But that critical care does not exist in our community. Now, that causes a couple things. Number one, it does get the person better quality of care because they have to go out and get it where the services are available. But then that also creates a second burden other than what happened to the person, to the family. Because now the family has to travel out of the area with limited resources, high unemployment. It becomes very difficult to do so. Once that person is stabilized usually and released, usually they do not have follow-up in our community. So now they are going to have to be coming to San Diego on a regular basis for follow-up and care, only creating additional financial burden on those families that are already making it from paycheck to paycheck or having so much harder. So we have identified services that are needed in the community, not only as patients, but also I talked at the beginning about unemployment. What it would create if doctors in our community were having the follow-up, specialty offices were being opened up, those jobs were being created, and those dollars are staying in the community. That gas money, that now hotel money no longer has to be spent out of town, but can be spent on groceries at home. And so it builds on more than one thing. And I know the topic here is healthcare, but we also need to be able to sustain healthcare in our communities. The second area is health and safe living. We need to improve access to nutritious foods. Although we live in what is deemed the salad capital of the world, we ship everything out. Everything goes out. It goes all over the world. It goes to many countries. We produce over $2 billion of beef every year, and most of it gets exported. from Japan to the different continents. It goes everywhere. But yet, our community, those who live in our community or crossed to either help raise that cattle or pick those crops, they themselves are having food insecurity. So I really like the program from the last presenter. I'm really going to look into it because it offers some opportunities. I started thinking, yeah, we have all these retailers that do deliver. What if we could find a way for healthy foods to be delivered to them in order to improve affordable food? Housing is a huge problem. Housing is only a fraction of what it is in San Diego County. A home that might be $900,000 a year in Imperial County, you could probably buy it for about $385 with twice the land that you would get here. But that's if you're able to come up with that down payment and make those monthly payments. So affordable housing, it's not what it should be. Working with some developers and showing them how they can take advantage of tax breaks for building in the area, we have been able to secure roughly 500 new areas for people that work in the farm. You have to be a farm worker to even apply. And you know, a lot of times the dollar investment, what it's going to take and what you're going to be able to gain out of that property is not going to be enough as an investor. However, if you add the tax breaks at the end and they end up being 7, 8, 10% more to the bottom line, all of a sudden you get investors' attention. And if you go further and you ask them, if you ask them to give you the concept of a small like type community center in that facility, we have one right now that's being built that'll be 365 units by the time it gets done. Give me room for a community center type facility, and now through the county we'll help bring you, there's all kinds of fancy names for it, but you know, now the going word is wraparound services. We will go ahead and have social services come in and spend a day there. We'll go ahead and have behavioral health come in and spend a time there and help people answer questions. Public health. All of a sudden we can have classes for them. We've talked to the Imperial County Office of Education. Will you bring in tutors from 3 to 5? Okay. So now not only are we finding a way to house farm workers, but we're also finding a way to give them those services that they can normally not go get at the offices, because by the time they're out of work, they can't get there or they can't make an appointment. And then the third area that we are tackling is behavioral health. And I think that there isn't anybody here that doesn't understand how behavioral health is feeding homelessness and affecting our law enforcement, and we understand how it's affecting your emergency rooms. And much like the issues that you are having in your facilities and in your municipalities and your county, we are having the same issues that we are looking for ways to handle and putting in programs so that we can better get a hand on them. So for example, where before 911 call immediately would send law enforcement to somebody who's having a behavioral health crisis, now we actually have teams that go out. Law enforcement just shows up, they kind of stabilize the situation a little. Our behavioral health department comes in, they talk to the person, law enforcement can go on to the next call. Okay. And then we have trained professionals in that field that then go ahead and deal with a situation and go ahead and make sure that the care that that person needs is taken care of. It is working. At first, we did a trial with one of the cities, a border city, Calexico. Next thing you know, the city of El Centro is calling and says, hey, we're just talking to the chief and the officers. They've gained all these extra hours that they can now go on other calls. And they did not have a situation in the middle of the street. Can you start it here? And it's now cross-populated across the county. So finding ways to deal with those three, what I think are priority ideas or priority needs will be really, really on our radar for the coming year.
Thank you for that thoughtful response. Chair Vargas, can I go to you, please?
Thank you for the question. So as I think about community health and really think about sort of what are the nuggets that you can take with you today, because all of you are experts in this field and you know a lot of the work that we're doing in the county. And so I think the way I look at what's going to happen in the year to come for the County of San Diego are two things. One is implementation, and the other one is the resistance component, right? But by that I mean implementation. We know what works and we know what doesn't work. What works is doing things and focusing our work as a region, right? The more we work together, the more we're able to identify priorities, the more we are able to bring in experts and have you at the table, the more we're able to make better decisions and are able to implement and are able to make things work. Because as much as I love our state legislators, and I know someday you will be one.
Maybe.
You know, the reality is that the implementation component is the most challenging piece, right? So everybody wanted SB 43 last year, but bringing people together and being able to say, okay, what is it going to take to be able to do this and do this right, and how fast can we do it was really critical and important. So bringing everyone together, providers, practitioners, people who actually had been impacted was critical, and I think those models really work. We're doing it with street medicine as well, right? We have models of systems that work, like what Father Joe's has done in terms of being able to provide the medicine for folks on location. But what does that look like, and how to make sure that all of you are part of that and working with the clinics so that we are able to provide the resources that people need, because the need is so great, right? The number of people who are still uninsured in this county are great. What is it? $11.3 billion come into the county for the region, to the region, not the county, to the region around Medi-Cal. And so we know that those that are in need us to be working together. And we know that when, we can't be working in silos, and we can't be thinking about housing here, homelessness over here. We have to really think about it from a perspective of how do we solve problems, and where do we stop doing what's not working, and how do we move forward and do the things that are working. One of the programs that I'm really proud of that we kicked off over a year ago was the Leave No Veteran Behind program, and it's a perfect example of a program that the county has been working on. We had about 800 former veterans, actually veterans who were formerly homeless or unsheltered, and we were able to do partnerships and programs with real estate folks, with our communities, and now we have over 1,000 of those, unsheltered veterans who are absolutely housed now, permanently housed. And so I think I only heard a little bit about what the gentleman was saying in the previous presentation, the keynote speaker. And I think what we need to stop doing is we need to start figuring out how to get out of our own way, so we can be practical and actually get things done. Because we talk a lot about what can happen and how we can do it, but instead what we really need to do is focus on what works. We know community health workers work, right? We know promotoras work. Why are we reinventing the model? We know that we need to get more young people and people of color into STEMs so that they can compete. Only 3% of Latinas are are doctors in California. That's ridiculous. We're like 40% of the population are Latinos in California, and we have a great need, and we don't have culturally competent folks who are providing the services and the resources that we need. We need people who are X-ray technicians. We need to partner up with I was going to say Southwestern College. I was there for 7 years. With community colleges, we need to be able to think outside the box about how do we do this. So that's what I say when I talk about implementation and to be part of the resistance. And by that, I don't mean, anything that's a different party than mine. What I mean is being resistant to just saying, we don't do that here. That's not how we've done this here. We need to knock it off with that. We need to wait. We can't do this anymore. We need to have vision, and we need to get out of our own way to actually implement, because communities are suffering, right? Communities are not getting the access to healthcare that they need. And that's where, counties and cities can partner together like we've done around homelessness, like we've done. I always say, if anything we can learn from is what we learned from COVID, right? That when we came together, we actually were able to modify regulations and be able to get things done, we got it done. And so for me, I think that's extremely important. In my district, I think all of you know, there are key issues that I'm working on. Different people have different ideas about how we need to solve those problems, but the Tijuana River Valley has been a top priority for me. Don't believe the hype, don't believe whatever everybody else is saying. The truth is I've been a champion on that issue. I declared it a public health care crisis 1 month into me becoming a supervisor. It has been a top priority, championing that issue, getting money from the EPA. Our congressional delegation has been absolutely exceptional on making sure we get additional dollars. But this is an issue that's been going on for over 90 years. 90 years, and no one has been paying attention the way we're paying attention now. There's synergy now. I'm nervous about what's going to happen with the new administration because last time they degutted the IBWC and some of the entities, and I won't get too much into the details, but I think we are moving forward with our partnership with the Mexican government, and it's a binational issue that's a very tough issue to address. And so we need to make sure that we don't lose track of how important that issue is. And then, of course, there are still children going to bed in this county every day hungry. That is a healthcare issue, and that should not be happening in the 5th largest economy in the world. We need to figure out how we address that. We work really closely with the First Five. We work really closely with our local organizations. But as you said before, right, community health is really about looking at a person from a holistic perspective and just reminding ourselves that folks are not numbers. They really are human beings that we have a responsibility to figure out how we make their lives better every day.
Thank you for those answers. And, it is a good reflection. You have definitely been in office in some challenging times, starting with COVID and obviously what's happening down in your community. So again, can't thank you.
100-year flood.
Oh, yeah.
Yeah.
I mean, it's
Piece of cake.
you got it covered. You got it covered. But, again, I will just reiterate, obviously hospitals want to be partners. So to the extent we can be helpful, please do lean in. Councilmember von Wilpert, if I can go to you.
Thank you. My colleagues mentioned a lot of the issues that weigh heavy on all of our hearts, including affordable housing, not just for your patients, but for your staff and providers. We're starting a pilot program for teachers in San Diego to give money for down payment assistance because teachers can't afford to live in the communities they teach, and it's just such an enormous problem. With $1 million, I will probably be able to help 44 families, which is wonderful for those 44 people, but there's a lot more teachers in need than 44. So if anyone has any bright ideas on fixing our housing crisis, let me know. Every time we try and build affordable housing, we get communities tell us, no, not here, don't build it here ever. So it's been a challenge. The cities are trying. I'm the chair of public safety, and I want to talk about violence prevention in our communities, because hospitals are on the receiving end of violence more and more lately. I know it's gotten so bad that the state legislature finally passed AB 977 this year to try and increase criminal penalties against anyone who threatens a nurse, a doctor, or a healthcare provider. We had an incident in Rancho Bernardo at Sharp Hospital, and Ellie Mainshine was instrumental in working with us. A patient came in who was mentally ill, who was threatening hospital staff, threatening other patients in the ER, and our police response didn't show up on time. In fact, it took almost an hour, more than an hour, 2 hours to get a San Diego police response to the hospital. So once Ellie told us about this, we got her in direct contact with the precinct captain and gave her his cell phone number. And he was incredible and made sure that the healthcare providers have a direct line to our police precinct now, because the violence against healthcare providers is so unique. It's hard to tell if a patient is going to be violent or not. And so now that was a partnership that we're working with our new police chief to make sure other healthcare providers have direct access to our police departments. Because you know when your patients are going to get violent. You know who the repeat offenders are. So we're trying to promote safety for your workforce. Another huge issue that I'm concerned about deeply is gun violence prevention. It got worse during the pandemic. And my greatest fear is that we have a school shooting in our community. So the very first law that I passed when I got elected was a ban on the illegal sale of ghost guns and the precursor parts to make weapons at home that were unlabeled, unserialized. You could buy them legally, no background check required, and make your own gun at home. So that was a huge effort, and now gun stores to sell them in San Diego, and now the county as well, because the county took action. You have to pass a background check to buy the precursor parts to firearms, just like you'd have to do a fully assembled firearm. I got sued within 10 minutes. We clocked it. 10 minutes, the county gun owners and the NRA sued, which is fine. That's their right. I don't take that personally. But we won. The federal court upheld my law, said it was not a Second Amendment violation to require background checks to access weapons. And that's actually been spreading throughout California. Other jurisdictions are doing that. We also just worked, and the county is actually taking this on as well, to change the way that we buy guns as a city. You know, taxpayers are the largest purchasers of firearms in this nation because we have to equip our police officers, our sheriffs, other law enforcement. So we give out huge taxpayer contracts, millions of dollars to firearms dealers, and it turns out we weren't checking who we were buying from. We were giving to the lowest bidder. Often that lowest bidder firearms dealer was having on the back end ATF violations, selling to straw purchasers, crime guns ending up on the street, and those emergency room gunshot wounds ending up in your hospitals. And so inadvertently, we were giving taxpayer money to fuel the gun crisis. So we changed the way we do procurement now in the city of San Diego. We were the first city in the nation to do it. Now others are getting on board. LA County is about to take this on. If you want a gun contract from the city of San Diego, you have to show you don't have ATF violations. You have to show how many crime guns have been traced back to your dealership by the FBI. And you have to show they're actually doing background checks, especially for domestic violence restraining orders. So that's one way that we're using taxpayer money to change the culture of violence in America.
Thank you. And obviously, yet another important issue. So we've covered a lot of ground. The one that I do want to ask, because I'm going to sort of skip ahead just in the interest of time, is around homelessness. I know for our hospitals, every year when the point in time count happens, we informally reach out to all our hospitals and ask the question, because when that happens, you know, obviously RTFH looks at it. We're looking at sheltered or unsheltered. We're never asking the question, how many are hospitalized or in our healthcare facilities? And sort of fast forward, what we've heard is essentially using some back of the cocktail napkin math. You know, we're upwards of 1,000 homeless a day going through our hospitals, which is a pretty significant number. So the question that, and I'll start with you, Mayor Jones, at this end again, how can local government, nonprofit businesses, and the general public work together to more effectively address homelessness?
Well, I always say most everything takes a village. And it's not a joke when I say that. It takes so many people working together. But part of that I think is so important, you know, I mentioned San Marcos is right around 100,000 people. Our point in time count was 18 this year. It's probably a little bit higher than that, but our biggest issue has been actually folks that are parking in RVs on the side of the road and moving around, being very transient throughout the county. And so, you know, there aren't borders that actually are throughout the cities. I mean, they don't know if it's Escondido or Vista or San Marcos. It really doesn't matter. I mean, at the end of the day, one person that's unhoused is too many. So we've been very intentional, as I mentioned a little bit earlier, and part of that is with good planning and working with the right developers and, you know, working very hard. And by the way, we did have one of the largest redevelopment agencies in the state of California, and we were always spending that money on housing. One of the things that we do is we actually have an in lieu fee that most developers end up paying, so we can pool that money into larger developments. So for instance, the development that we opened up yesterday, 94 families that now have a good, nice, clean, brand new place for them to live. There was actually one of the folks that spoke that actually lives there. She just moved in. She was diagnosed with cancer earlier this year. And so unfortunately, with all of the healthcare costs that ended up happening with her family, they ended up being homeless. And so her having a good place to live, she just, as I mentioned, moved into the development that we opened yesterday. It was Estrella. it was something that really goes to show that if we do, do a lot of proactive sort of efforts in a community, that you can keep people from becoming homeless or rescue them pretty quickly thereafter. One of the things that I've heard from so many people in our community is that you have all this housing, 24, by the way, it's 24 unique neighborhoods that are 100% deed restricted affordable. I think more than any other city per capita in the county. We have a lot, like I mentioned, almost 3,400 units. Is how do we actually get on a list? How do we actually utilize the housing? Because we have also, I think, outside of that 18 homeless number, is people that are living on people's couches or crashing on, in their neighbor's home for a certain amount of time. So what we're trying to do is put together a list where because now as it is, you have to take a day off of work, you have to go into all these different 24 communities and actually sign up and show up and sign up to get on the list. So what we're working toward is having a list where you sign up at one site on our city site and it goes to all 24 communities so that it's easier. You don't have to take a day off from work because let's face it, the folks that are the most vulnerable can't really take that time off of work. So we are working to better that process. The other part of it, because I mentioned it takes a village, is we need to also make sure our nonprofits are coming together and providing all of the services. And that is something that is not, I think, happening all the time, every day as an easy thing. People call up 411, which we all, spend money utilizing, and it's not always easy. It just doesn't work. I mean, if you're desperate, you're trying to find a place to live, that's a problem. One of the things that we have in our city also is one safe place. So people that are victims of some sort of abuse, they can go there, whether they are being rescued from human trafficking, they're a victim of elder abuse, or if they are, a domestic violence situation, they can leave quickly. And right now, our district attorney, Summer Steffen, is working on having temporary housing at that shelter in San Marcos, which we are wholeheartedly behind because many of the folks that are having an issue within their home, within their own home, really need to get out immediately so that we can help them so they don't end up in your emergency rooms. And so having that temporary housing available for them as a quick intervention for them is really very important. So those are some of the things that we're doing in the city. But homelessness, I hate to say, there are a lot of people that are one step away from homelessness. And the city of San Marcos has spent over the last, I want to say at least 10 years that I've been on the city council. We started out at around $65,000, I think, before 10 years ago. And then we ramped that up to $125,000 a year, where we put that into a regional shelter network. But it also can be used through folks like Interfaith, where it could be a couple of months' rent, or it could be used for whatever the needs are, because every single situation is a little bit different. So we really like to try to be flexible with that funding. And anyway, so we're going to continue with efforts like that to help folks so that they don't actually become homeless in the first place. But if they do, we will certainly try to help them as much as possible.
Thank you. Chair Plancarte.
Thank you. By a raise of hands, can I see how many of you serve on hospital boards? Okay. Sorry if what I say offends you, but I also serve on a board. From the lessons learned during COVID, I had the trial by fire of being the chair of the Board of Supervisors when COVID started and for the next few years, and being on the board for the next few years. One of the things that I learned from that is that the hospitals, the healthcare system was doing everything they could imagine to keep the community safe, maintain open beds, keep their staff safe, keep everything going. Us as government, we were doing the same. We had tons and tons of nonprofits out there doing the exact same thing, trying to do the community well with the things that they needed. There was one huge thing missing. We weren't communicating with each other. We were not communicating with each other, okay? One hospital in our community was thinking of doing one thing while the county was taking preparations to do something in a different. I'm not here to debate which one was right, which one was wrong, what the priorities were, but by gosh, if we would have been sitting at the table and having these discussions on how to phase things in when it is needed, we would have done a lot better. Nonprofits. We had nonprofits that were spending all kinds of money trying to shelter people and isolate them. At the same thing, we had other nonprofits going to buy 200 pizzas at Papa John's and parking out at parks and saying, come on, get the food. They had a good thing at heart, but now with what one nonprofit was trying to isolate people, the other nonprofit was trying to bring them together. I think that we need to figure out how to communicate. And that is going to be up to the employees of the organizations, because you are the constant in those organizations. Very often as board members, to me, a board member gives long-term direction, says this is where I want to go, this is where we need to do, and then the team does it. And as they need resources along the way, then they need to come and tell me, hey, I need a bigger hammer, or I need a bigger whatever they need for the task that you ask. Then it's my job to get it to them, but not to micromanage, not to do the day in, day out. And so I found myself that a lot of the boards, whether they were hospital boards, nonprofit boards, board of supervisors, that was me, I was a chairman of that problem, school boards, we were not communicating. Homelessness, I see the same issue in a very, very similar way. We have, for example, people on the street that are out there every morning that law enforcement goes to try to arrest them or do, some neighborhood cleanup, only to find out that had they contacted our behavioral health department would have said, no, Susie's not homelessness. Susie's not homeless. This is her address. This is where she lives. This is what she does. But guess what? That is the environment that she likes to go out into every day at 8 o'clock. And she loves to hang around with them, okay? And then towards the end of the day, she goes home and checks on her parents, and that is her lifestyle. Had we communicated, or had law enforcement communicated with us, either way, that would have been availability of officers. It would just have created all these synergies that would have not been spent. Communication. Remember, at the end of the day, as the employees, I know in California it's not a good thing to say the word permanent employee, HR departments hate that. But as a permanent fixtures in the companies that you represent, communicate with your equals in all the other agencies. Keep those open lines of communication, and I think we will get much, much closer to collectively improving our homelessness issues that we have.
Thank you. Chair Vargas?
Thank you. Addressing our unsheltered population has been a top priority for myself in the last 4 years and for our Board of Supervisors. We have spent, I think the majority of our budget is not only in behavioral health, a large portion of it, but also in creating programs and initiatives that are going to help address the problem once and for all. And I remember sitting in a meeting and, when I first got elected, and with Nick Machoni, and he was a health director at the time, and he said, what's your why? And I said, well, I want to eradicate poverty. That is my why. But how do we do that, and how we do that in bite-sized steps, because we can't do it all at once, is let's think about how we actually find real solutions to end the problem of homelessness. We can't just keep saying, we're going to create more programs, we're going to create more things. We need to figure out, do we really want to end people in our communities not having access to a home? And so I think redefining for us as a county that access to a home is a human right to us, that everybody being able to be housed is a priority, is I think what we changed our philosophy of how we were doing the work from the board perspective, so that we can support the work that the county team had been doing already and really provide the direction that they needed. And so we've created programs, like I mentioned to you, like the Leave No Veteran Behind program. We've done programs so that people, we're seeing that the majority of 55 and older are the folks who are becoming homeless. And so what do we do with supplemental funding so that they are able to stay in their homes, right? Because once somebody becomes homeless, it becomes more difficult for them to actually find a home again. And so we have been prioritizing that. And I want to have an assessment. I want to know, where are we spending our money? How are we spending our money? And so that blueprint for addressing that work is coming back to the board, so that we can figure out, where is the money going? Do we need to stop doing some things? Do we need to do things better? And I think that's something that we have to do constantly as government. I come from being an executive in a nonprofit where we were actually able, if something wasn't working, we could just stop doing it. That doesn't work in government, right? Or it should work in government, but that's not necessarily the philosophy in government. And people get really nervous when you start talking about things that way, because first thing people think about, it's my job. I really believe that we need to look at it from how do we redirect? How do we retrain? How do we make sure that we're actually using our resources so that we are actually solving a problem? So for instance, I asked, how many of you know where the jungle is in Bonita or in South County? Have you heard of it before? Yeah? Okay, so that is a place that is right, Plaza Bonita, come visit us in South Bay, right off of the 805 freeway. And it's a whole area, technically looks like a jungle. And I remember I was a staffer for Congressman Filner back in 1993. I mean, I go back for a long, many, many years. And everybody always talked about the jungle. We provided educational programs in the jungle for the kids who were living in the jungle. And to me, it's ludicrous. Why do we think it's okay that people live in the jungle? Like, why do we think in the 5th largest economy in the world that it's okay for people to live in the jungle? And so we were able to fight for funding from the governor's office, and we were able to bring those dollars. And now we've actually cleaned up the jungle. People are not living in the jungle. There's still some people there, but we've been able to minimize how many people live in the jungle. And we did that by making sure that our experts, right, Chula Vista PD, National City PD, Caltrans, all of them came together, worked together to make sure that we build that trust with that community and try to find them actually permanent housing. So I think what we need to really do as providers, as government entities, and as communities is start looking at the question from a different perspective. Are we trying to end homelessness? Are we trying to actually make sure that people actually have permanent housing? Or are we just trying to create more programs to support the issue of homelessness? And I think we're doing it backwards. And so when we say things like we're going to focus on SB 43, or the fact that Care Court actually working, one of 7 counties that's actually doing this program, one of 7 or 6, Kim, I can't remember. Kim Georgina is here as well. One of 6 or one of 7? One of 7? 7, one of 7 programs. And if you haven't met Kim, she's our new Director of Health and Human Services. She's amazing. Get to know her. She's a great partner with the community as well. And so 1 in 7, Care Court, it's actually working. People thought it wasn't going to work. People are actually voluntarily going into these programs with their families. Public defenders are part of it. Our county team is part of it. We have a mental health care providers that are working with folks. But we're being very methodical at the county about how the implementation process works. And Dr. Luke Bergman is not here, but he is also someone who's a treasure at the county who does such amazing work because he understands that we have to look at things holistically. And I'll end with saying this. Look, we have about 10,000 people who are homeless or unsheltered in the county of San Diego. One thing that you all have to remember when we think about our binational community, and we don't talk about this often, is that I believe that the numbers would be higher if it wasn't for the fact that people can live in Tijuana. We don't talk about that. Now, what we're doing is we're gentrifying Tijuana, which means that people in Tijuana can no longer live in Tijuana because people from the States are going to Tijuana. There's about 200,000 people that cross the border in San Diego every day to go back and work and school, right? Because people can't live in San Diego anymore because it's so expensive. So housing, we have a housing blueprint. We've been investing in middle class housing, et cetera, but this is a regional border issue that we need to look at because if it wasn't for the fact that people can live in Tijuana, so how many of you have patients? You don't have to raise your hand. How many of you have staff members who live in Tijuana? I bet you all of you will raise your hands. And sometimes you have to adjust because border waits are 3 hours or 4 hours. So when we're advocating at the federal level for border waits, for the New Otay Mesa port of entry, when we're doing all of this stuff, we're doing it because we need to alleviate, and I haven't even talked about the environmental issues of the border waits and all this other stuff, right? But it's extremely important for me that we start looking at this as, are we trying to end homelessness or are we just perpetuating something by not really thinking about what in the end is the actual core of the issue? And that's what I want us to make sure that we give the power to our county teams to say, this isn't working, we're gonna stop doing it, we're gonna try something new. And it's okay for us to fail and work with our partners in nonprofits, work with our communities. We held an 18-city convening with all of the cities and heard from them about some of the challenges that they were having. And then, we also have to make sure that we listen to the community, right? Sometimes putting tiny homes in backyards of our communities that have for so many years have been underinvested, underimpacted, and they don't want them there. It's not because they're YIMBYs. It's because they don't want their housing to be devalued because they don't understand that particular community was going to be impacted in a different way. So I think we need to really think about this from a very big, holistic perspective and work together as we're moving forward.
Thank you. Councilmember von Wilpert.
Thank you. The city of San Diego, homelessness is one of our biggest challenges. We hear it all the time. Although I do believe that most of the burden for homelessness is sitting in our healthcare system, in our emergency rooms often. And that's a huge strain on the system and on your systems. So I'm glad that Chairwoman Vargas is the chair of the Board of Supervisors, because since you and Tara and Nathan and now Monica have been elected, the county has been partnering with the city much better than our two organizations had ever worked in the past. We are in the business of brick and mortar shelters for homeless individuals. We have 2,000 people in shelters every night in San Diego, and that's still not enough. But what we need is the partnership from the county for health and human services, on-site addiction treatment, on-site mental health services. And we've just started 2 shelters, 2 community harm reduction shelters to do that, and they've been more successful in placing individuals when you have services on-site than when we have these disjointed systems. And so I'm looking forward to continuing that partnership and when working more together. When I think about our city budget and the amount of money we spend on homelessness, I have a choice between prevention and crisis response. Senior citizens, as Chairwoman Vargas said, are some of the highest growing numbers of people we're finding on the street unsheltered. People who are living in their golden years on the street because their rental prices are increasing and their Social Security is not. Mm-hmm. So we decided to divert some of our homelessness money away from building a new shelter to shoring up the rent payments for 155 seniors and families with disabilities, to try and keep them in their homes, pay that extra $100, $200 a month to prevent them from becoming homeless, because we think it's more effective and more cost effective to keep people housed than let them enter the system. At the same time, that's less money I have for the people on the street and the crisis on the street. And so it's this big chicken and egg issue that I deal with every day in our budgets. One thing we're working on hard is trying to reduce the burden on our EDs by funding a conservatorship and treatment unit. We need the county's partnership, and you've been moving and opening doors to help, because the city of San Diego, we can't do LPS conservatorships. Only the county can under current law. But guess who picks up those patients is our ambulances and our firefighters every day. We had one gentleman, Alfonso, who called 911 500 times in a calendar year. And he would end up in emergency rooms most of the time. So finally, we petitioned for a conservatorship for him. He was gravely disabled. He had no family showing up to the emergency departments. He had no one to care for him. After his 500th 911 call, where did we find him? On the trolley tracks trying to commit suicide. So we're pushing hard to get people into conservatorship who cannot help themselves or others. We're eagerly awaiting the transition. I understand, though, why SB 43 couldn't be implemented now. And kudos to you for your leadership on that, because I'm sure you're getting tons of pressure from people like me. So I appreciate that. So we're working quite a bit to try and change the way we do medicine, street medicine. We have an incredible resource access program at the city where we have physician's assistants now. One of the things we used our opioid settlement money for, which is a huge problem nationwide, by the way. Please lobby your state and local officials on how they should use their opioid settlement money. A lot of it is not going to opioid abatement. I pushed hard to make sure we used it to partner with UCSD and make sure we had people in the ERs. We also used it to buy a medical treatment van, 2 of them, so that our RAP team and paramedics can open up the door and treat people like a hospital room in that van for BLS care. They're able to dispense Suboxone now, first through pills and then through injection on the street. So that's one way we're trying to relieve the burden on the hospitals of the homelessness crisis, is by diverting some of these homeless patients from even ending up in your emergency departments. But we need your partnership, because I am a lawyer. I promise you, if you scrape your knee, you're probably dying. I don't know, I can't help you. But you guys know the healthcare system very, very well. And so please interact with us. Call us. I was so pleased, Dimitrios, when you reached out to me during our ambulance negotiations to explain to me that the Falk and AMR were blaming the hospitals completely for wall times. And you educated me on why that was not the issue. And so please, our doors are open. We want to hear from you. But I put out so many fires every day, literally and figuratively, that sometimes I don't know to reach out. So please continue. That's why this relationship is so important. And you have an incredible advocate here in Dimitrios. He makes sure to call us, round us all up, get us together. But I'd love to keep partnering with you, because like I said, your patients are my residents. So thank you.
So let's give this panel a round of applause. I will wrap up this panel with this. Collaboration is going to be the key to solve any number of issues. We covered ground from housing to homelessness to behavioral health to our EMS system. And what is clear is we are fortunate to have some great leaders that we can depend on, that we can lean into. And together, going back to where Mick was right before this, anything, we can accomplish anything. It's definitely not impossible, but we have to be on the same page and have to work together. So thank you for your time. And this panel will conclude. I just have brief remarks. I know we're slightly over, but let's give them one more round of applause.